Welcome back to Dr. Sellers Educate as we continue to focus on the hallmarks of nursing excellence that have been developed by NLN and published in 2020. Now, if you're not familiar with this resource, we will be covering every single hallmark as designed by the NLN organization. You can find that resource over on the NLN website, and let's go ahead and take a look at it right now just to refresh everyone about the actual model. If this is the first time that you are tuning in with us, welcome to Dr. Sellers Educate. We are happy that you're here, and we're thrilled to support you on your journey towards achieving certification on the NLN Nurse Educator exam. The series that we have been focusing on has been looking at each of the hallmarks, and we are aligning the content for the CNE exam with the actual hallmarks of excellence that we are covering. So just as a recap, we first started our series looking at hallmark number 1. There are actually a few subsets of topics underneath hallmark number 1, centered around engaging students. What strategies are we using? What questions are we able to answer yes to, as listed here under the indicators? And just as a refresher, the hallmarks of excellence is a model that was developed by NLN, and it provides a framework, if you will, for us in nursing education to achieve excellence in our nursing programs. This goal, this initiative really is centered around not only the nursing program hallmark of excellence, but also what strategies can we utilize in the learning experiences with our students to ensure that we are creating the best learning environment possible for them. All right, so again, we started with hallmark number 1, which is engaged students, and we transitioned to hallmark 2, diverse, well-prepared faculty. In our last snapshot, we focused on hallmark 3, establishing that culture of continuous quality improvement, and that brings us to hallmark number 4, which we are covering in this snapshot, specifically focusing on innovative evidence-based curriculum. There are a couple of categories under hallmark number 4. So first is making sure that the curriculum is designed in a way that's going to help students achieve stated program outcomes, and it reflects current societal and healthcare trends and issues. That probably sounds familiar because we're going to take a look when we finish up reviewing the content related to curriculum. We're going to take a look at the competencies for CNE and just map back to those specifically. And then the second subset category underneath hallmark 4 is that the curriculum should provide learning activities that enhance students' abilities to think critically, reflect thoughtfully, and provide culturally sensitive, evidence-based nursing care to diverse populations. What you want to do with this model is go through each of these indicators listed underneath each of them and just answer yes or no, or provide an explanation. This is going to give you an opportunity to do a really good self-evaluation within your nursing program, within your practices as a nurse educator, to make sure that you are focusing on all of the different tenets in your nursing program and determining what areas you need to improve in. Okay, so this is, again, an opportunity for you to do a self-assessment, a self-reflection, and do a deep dive into better understanding where the opportunities are within your nursing program. And then the last 2 subcategories underneath hallmark number 4 looks at students' values development, making sure there's an emphasis there, and then making sure those learning experiences are going to prepare our graduates to assume the role as a practicing clinician. Oh, and I forgot one more. And then tie in directly into that one is making sure that we are integrating into our curriculum those evidence-based practices. All right, so those are the 5 subcategories underneath hallmark number 4, focusing on what our efforts are in developing an innovative evidence-based curriculum. All right, so now let's go ahead and map those back to the actual competencies. This is the CNE candidate handbook that we have in front of us. And I am going to just spend some time, if you want to go ahead and pull out your copy, if you're on the CNE journey. If you're on the CNE CL journey or CNE novice, I do want to take a moment to pull up those specific handbooks as well. Okay, so if you are on the journey for CNE, let's take a look first at your handbook. And then if you are on the journey towards CNECL, we're going to take a look at that handbook as well. All right, so you can see here competency 4. There are several sub-competencies that we have covered here. Make sure that as you are either focusing on getting ready for the CNE, or if you're renewing your CNE exam certification, make sure that you are going to the NLN website and that you are aligning the resources that you're reviewing and that you're participating in underneath this specific competency. Okay, so this specific content for Hallmark number 4 is aligned with competency 4, looking at our participation and revision of the curriculum design. It's also aligned with the expectation that we are completing that self-evaluation and exploring how we can improve our nursing program. And also being a change agent. Okay, so just making sure that as we identify opportunities to improve our curriculum, that we are going to the evidence, that we are extracting that information, and we are aligning our changes to the curriculum or to our nursing program, to making sure that we are aligning those changes with the change theory, and also providing our faculty a chance to really process those changes and to collaborate with the leaders that are moving the change forward. That collaboration part is so important. All right, so now let's take a look. I'm going to stop sharing for 1 second. And now let's head over to the website for NLN. And I want you all just to spend some time here taking a look at the resources that are available. First, let's start with the CNE novice. Okay, so for those of you that have less than 3 years of experience, this is a great resource for you. And we're going to go ahead and take a look at the handbook and map back the specific Hallmark number 4 to content in your candidate handbook as well. All right, so if you scroll through, what you want to make sure you do is, if you're on a journey to novice, that you're reading the handbook cover to cover, okay? And the specific competencies that are part of CNE novice, you're going to align it with competency 4, competency 5, competency 6, as well as competency 7. Okay, so those are the primary categories that you are aligning Hallmark number 4 to. And then also facilitate learning. Okay, as we take a look at our practice question in a second, I mean, you're going to see the relationship between the practice test question, Hallmark number 4, and facilitation of learning. All right, and then last but not least, let's go ahead and take a look at the CNE clinical handbook. Because again, our goal here at Dr. Sellers Educate is to support you until you are successful and across all 3 of the certifications. Okay, so just know that we have resources that can support you in being successful with all 3 exams. We continue to have a 100% success rate for those nurse educators that are taking the CNE novice exam. So we're always happy to hear feedback from you all about your experience, and we do track our success rate. All right, so this is the CNE clinical candidate handbook. You want to make sure that you are printing out the specific handbook for the certification exam that you are completing, and you do want to read it cover to cover, okay? The good news is it's roughly 25-30 pages, okay? So we don't want you, though, to miss any content that may show up on your certification exam. You also, while we're here, let me just point out, you want to make sure that you review eligibility requirements and then you meet one of the options, okay? There's a couple, depending on your exam. If you have any questions about whether or not you meet eligibility requirements, the first step is to email NLN or give them a call to clarify. And now we're going to scroll to the actual blueprint, okay? Just like with the CNE candidate handbook, every candidate handbook has a test blueprint that's more generic, and then there's a detailed test blueprint to follow. The detailed test blueprint is the resource you are using to complete your self-assessment, and then the next step is you are using this blueprint to develop your 7-week study plan. All right, there is information about the 7-week study plan in the description right here in this episode. All right, so let's take a quick look at how the content we're reviewing under Hallmark 4 aligns with the CNE clinical exam. All right, so when you think about our responsibility to ensure that we are developing an innovative, evidence-based curriculum, there's a strong connection with the clinical setting, right? Because students have to apply the concepts and the theories that they learn in the didactic setting in the clinical space. So there are several that this aligns with. First is going to be facilitate learning in the healthcare environment. Also making sure that we are applying clinical expertise in the healthcare environment. Those are the two primary ones. And then there's also some relationship with the facilitation of learner development and socialization. All right, so let's go ahead and take a look at our practice test question. Hopefully you all have had a chance to think about the correct answer. If you had a chance to review it in our description in advance, if you didn't, that's okay. We're going to review it together. As we look at each of these competencies and really the hallmarks of excellence, you want to make sure that you are going back to your primary sources to help you close your knowledge gaps. And that's going to be Dr. Caputi's review book, 2nd edition, and Teaching and Nursing by Billings and Halstead, 6th edition. If you are on the journey to CNE-CL, you can find that resource as well for you in the description, and that's Teresa Shellenbarger's CNE-CL competency resource. All right, so let's take a look at this practice test question. It's related to the innovative evidence-based curriculum standards. So which clinical experience would best prepare learners for transition to practice? This content is mapped back to facilitation of learning, curriculum, change agent and leader, and scholarship, okay? So if you chose D, you are correct. And let's talk about why. Remember that as you're going through the practice test questions, we're all excited when we choose the correct answer, and we want you to understand the rationale for the incorrect choices as well, okay? So D is the best option, providing complete care for 3 medical surgical patients. The rationale is that learning goals may help facilitate learners' ability to synthesize information, integrate didactic and clinical knowledge, develop clinical reasoning and judgment skills, and plan care for groups of clients. Assignments that involve planning care for clients with complex needs and for multiple clients as an option D are appropriate and would assist learners preparing for the transition to practice. We know that when nurses graduate and work in a med-surg area, they are going to have to prioritize, manage their time, and ensure that they are making sound clinical reasoning and judgment decisions to practice safely, right? So there are competing priorities that nurses will have to deal with. It's a great plan to help students increase their nursing or their patient assignments, because then they can adjust with support and guidance from their clinical faculty. Okay, so again, you want to go back to the evidence when we talk about establishing curriculum standards, because remember that our clinical experiences should align and map back to the learning objectives that we're expecting students to be able to complete, and the actual clinical practices and what they are learning should align with content that we are teaching in the course. As much as we can marry the two of them at the same time to occur, the better, the stronger the congruency is going to be for our students as it relates to their ability to apply the concepts that they're being taught in class, okay? Shadowing a nurse, such as in option A, interviewing multiple clients, option B, and implementing a care plan, option C, are not the best clinical experiences to prepare learners for a transition to practice. Remember, if we go back, this question was all centered around transition to practice, right? When you're reviewing the actual question on the CNE exam, you want to be clear about what the question is asking, okay? Remember that you have 150 questions on the exam, and you will have 3 hours to take the exam. So you want to make sure that you are managing your time wisely as you move forward, but make sure you're reading that question and you're understanding exactly what it's asking. All right, well, this is the end of our snapshot. Make sure you subscribe if you haven't already. We hope this has been helpful. Our contact information is here. You can reach us at info@drsellerseducate.com, and we will see you in the next episode. Have a great one, everybody. Bye-bye.